have a lovely patient here who's come in this morning and is going to be coming every day except Wednesday this week and Saturday as well while we make her some new teeth. Okay.
Can we have a translation, please?
និយាយទៅគាត់អ្នកជំងឺនឹងគាត់មកជួបយើងរាល់ថ្ងៃលើកលែងថ្ងៃពុធទេដោយសារថ្ងៃពុធជាថ្ងៃឈប់អញ្ចឹងយើង examine ហើយគាត់រាល់ថ្ងៃ
So I'm just going to start by asking the patient some questions. Why has she come today?
អូខេអញ្ចឹងមិនបាក់យើងថ្ងៃហ្នឹងមកដល់ហេតុផលអីបានមកយើងបាន
So she's coming for some dentures.
អូខេអញ្ចឹងដោយសារតែគាត់មកយើងត្រូវសួរពីសំណួរខ្លះៗទៅយើងសួរគាត់ថាគាត់មកដើម្បីអីគាត់ថាគាត់មកដើម្បីយកថ្មី
Has she worn dentures before?
បាក់យើងធ្លាប់ពាក់ពីមុនអញ្ចឹងសំណួរទី2យើងសួរគាត់ថាតើគាត់ធ្លាប់ពាក់ denture ពីមុនអត់គាត់ថាគាត់ធ្លាប់ Yes.
Does she have them with her?
មានយកមក
ក្នុងស្បោ
Yes.
When we get them, where are they? Your daughter has? We'll look at those in a little while. How long have you had these for?
មកយើងពាក់មួយឆ្នាំ
ឆ្នាំ2000
since 2000
Since 2000. And when did you have all of your teeth removed?
អញ្ចឹងមកយើងមកយើងដកថ្មិញអស់ពីមាត់មកពេលណា
2005
ដល់ពេលទៅមកយើងពាក់អាហ្នឹង
ពាក់ឥឡូវហ្នឹង2000
បាទ
ដល់ពេលក្រោយ2005
Oh, she went her upper denture at 2000 and she went her lower denture at 2005. So her teeth all go at 2005.
Okay, all right. And how long did she wear an upper denture for?
អញ្ចឹងមកយើងពាក់ខាងក្រោមស្លាកខាងលើតាំងឆ្នាំ2000ទៅយើងគាត់អាចលើអត់អី
So what we're finding out here is that our patient has worn a full upper denture for 14 years.
អញ្ចឹងអ្វីដែលយើងចម្លើយដែលយើងបានមកពីសំណួរហ្នឹងគឺសំខាន់មួយថាអ្នកជំងឺគាត់ពាក់ថ្មិញ denture ខាងលើហ្នឹងរយៈពេល14ឆ្នាំមកតាំងពីឆ្នាំ2000
And she's worn a lower denture since 2005, so that's 9 years.
ហើយដល់ពេលថ្មិញខាងក្រោមវិញគាត់ពាក់តាំងពីឆ្នាំ2005អញ្ចឹងអស់រយៈពេល9ឆ្នាំ
What is the problem you have with these dentures?
អញ្ចឹងមកយើងកាន់មកយើងពាក់អាចចាស់ហ្នឹងមកយើងមានកន្លែងណាអត់ស្រួលទេ
វាអត់ស្រួលគេយកទៅស្រីឲ្យ
ណាប៉ុន្តែចំណុចអត់ស្រួលហ្នឹងវាខ្លះហើយ
វាខាងទៅទៅសាច់យើងនេះរបស់កសាច់ចាស់នេះយើងនេះឈឺគេទៅគេស្រីឲ្យវិញ
Yes, you know the denture border is forced to the gingiva so impossible.
So I've just asked, what is wrong with the current dentures? And our patient's given me a very good answer. She's saying that the borders of the denture are rubbing on the gum and causing her pain.
សំណួរដែលគាត់រកឃើញសំខាន់ថាគាត់សួរថាតើអ្នកជំងឺបញ្ហាគេខ្លះដែលថ្មីស្និទ្ធលើមុនមានហ្នឹងអ្នកជំងឺគាត់ឆ្លើយប្រាប់វិញថាអាចាស់ហ្នឹងពាក់ទៅដោយសារតែកែមរបស់ denture ហ្នឹងទៅកកិតជាមួយនឹងអញ្ចាញធ្វើឲ្យឈឺ
So is the lower denture loose?
មកនិយាយថ្មីស្និទ្ធខាងក្រោមមកនិយាយដូចលបាយវាខុយវាលបាយ
ឥឡូវហ្នឹងអាហ្នឹងវាលងហ្នឹងអាហ្នឹងវាចាស់វាលងហើយ
So
គុំបាយព្រោះកាលនេះវិញចាញ់វិញយើងដកព្រាមមកយើងនៅពេញចាញ់តែយូរយើងស្កាត់ទៅឥឡូវវាទៀបទៅវាអាចហើយតិច
Yes, what she
ទាំងលើទាំងក្រោមដូចគ្នា បាននិយាយចាំដូរ
So the patient has been at my lecture this morning and she understands that her jawbone has shrunk and her denture has gotten loose. So because the jawbone has shrunk, the amount of support has reduced and that's why the denture is loose.
អញ្ចឹងគាត់បាននិយាយថាដោយសារតែគាត់ពាក់យូរយូរទៅអាថ្មិញស្គៀមខាងក្រោមគាត់បាទចាញ់ខាងក្រោមហ្នឹងវារួមតូចអញ្ចឹងទៅធ្វើឲ្យdenture ខាងក្រោមមកលង
So if the patient's denture is loose,
ពេលវាលងញ៉ាំអីចេះចូលយើងទៅដោះចេញពលមកសាថ្ងៃអញ្ចឹងដូរ
She said that the denture when it become loose the food
get under it.
yes get up
Yes.
yes
Thank you. Good answers. So because the denture gets loose, the food gets under it, and it's difficult for her to chew, and that's when the edge of the denture causes pain.
គាត់ថាដោយសារតើអា denture ខាងក្រោមនោះអាឡុងធ្វើឲ្យចំណីអាហារវាទៅស្អិតនៅក្រោមហ្នឹង
យើងញ៉ាំទៅយើងពេលក្លែងដាក់ទៅវាជូរតែជើងញ៉ាំទៅចាក់ចាំមកហើយយើងឡើងទៅបោះរៀនហើយដាក់ហូបខាងទៅយ៉ាងទៅ
session to repeat washing
Yes. So the patient is constantly washing the denture because food gets in underneath it.
អញ្ចឹងអ្នកជំងឺគាត់ចេះតែដូចថាដល់ពេលដែលមកហូបកាកសំណល់អីចូលក្រោមនឹងអញ្ចឹងទៅគាត់ចេះតែដោះលាងរហូតដដែលមុននឹងគាត់ញ៉ាំបាយ
So if the patient's jawbone, if the mandible has shrunk, what would you expect to find when you examine the dentures? What would you expect to find with regards to the freeway space?
អញ្ចឹងនៅពេលដែលalveolar bone ខាងក្រោមយើងវារួមតើយើងរំពឹងថាយើងនឹងឃើញអីគេនៅពេលដែលយើងធ្វើ examination តើតើជាមួយនឹង freeway space
It will be bigger. Yes, good. Okay. The upper denture, is the upper denture loose?
ខាងលើបើមិនស្និតខាងលើវាឡុងដែរ
វាលងដែរតែលងតាំងពីរ
ឡុងទៅទី
លងតាំងពីរ
yes both of them are loose
So the upper denture is loose too. So the support in the upper denture is compromised.
អញ្ចឹងនៅខាងលើខាងក្រោមគឺវាឡុងដូចគ្នាដោយសារតែ support ហ្នឹងគឺវារួមតូច
ស្បាត់ឡើងស្បាត់ទៅទៅវាលង
និយាយពេលដែលពាក់ទៅដែលវាសក់ធ្លាក់ទៅចាំបងធ្លាក់មក
អត់ញ៉ាំតែទៅញ៉ាំ
So
ហើយយើងទៅផ្លាទៅពេលដល់ទៅពេលអញ្ចឹងទៅតែបលមកគេមានរុញណាឥឡូវហូបចុះក្រអកឥឡូវនៅនេះមានរបស់កាន់ចូលយើងញ៉ាំអាហារទៅវាចូលតាមគេនឹងអញ្ចឹង
ចឹងវារបូតដែរ
អត់របូតទេដល់ពេលយើងញ៉ាំហ្នឹងវាអត់របូតវាកាន់តែហៅទៅចូលអាហារយើងពេលមកតិចចូលទៅដើម្បីវាអរគុណហ្នឹងវាប៉ះ
She said that it's never fall off but instead it get low so the food can catch it
yeah, it's under it.
yes
When she smiles,
ណាស់យើងចង់ដូរថ្មី
can she see her teeth?
មកនិយាយពេលមកនិយាយសោចឹងនិយាយមើលឃើញចំណុចខ្លួន
ឃើញ
yes yes
And does she like the look of those dentures?
មកនិយាយកាលមុនស្មានថាអត់ទេថារៀងណារៀងស្រីរៀងហើយគាត់ចាស់
mình việc lây ở đâu mình lây lại vô chọn bằng vay của lâu bên cạnh này cảm ơn cái vay với ở lâu bên nó phần này chọn học cách là đó đọc mà rồi khẩu nghe còn buồn làm việc khơi chứ nó cao thứ nó vay cho mình dương phòng làm cho đây dùng chú tốt về
She said that the denture teeth is artificial now so it lost its vertical the denture is
Yes. So when we look,
she wants to restore her vertical
I know she does. She's well educated. So if we look, yes, they're worn. Yeah. Yes. Blunt. So we can see the denture teeth are quite worn and blunt. They've lost their cusps. So this patient has eaten really well on these dentures. We can also see that she's cracked the denture base and that some wire has been put in to strengthen it.
yes
And we can also see that she's got a bit of a torus here. Okay. And that the denture doesn't extend all the way back necessarily. There's the hamular notch,
yes
but we might be a little bit forward. So we'll have a look at that. And I think the other thing that we can see here is that the okay, and that shows how much resorption has gone on. Okay.
let's just flip it like so I can see it just flip no let's see the teeth
Sorry.
អញ្ចឹងយើងមើលឃើញថាថ្មិញហ្នឹងវាសឹកអស់ហើយអាថ្មិញហ្នឹងអា cospit អីបាត់អស់ហើយយើងឃើញថាអា base របស់ខាងលើហ្នឹងយើងដូចវាផានតិចសូម្បីតែ clap ហ្នឹងក៏ឃើញចេញមកបន្តិចដែរ
cha về đua về đẹp về đâu những mình bộ tay lẹ đó chuyện trong thôi cái ban họ trong đâu đạn
ហើយយើងឃើញថាខាងលើនេះអាកន្លែងនេះយើងឃើញអាខាងគៀនហ្នឹងមកដល់ហាមូឡានដល់ចៃប៉ុន្តែស្រាប់តែពេលអាខាងកន្លែងកណ្ដាលនេះវារៀងចូលបន្តិចវិញវាអត់ extend គ្រប់គ្រាន់ហើយបើសិនយើងសង្កេតមើលច្បាស់វិញយើងឃើញថាអាខាងលើហ្នឹងវាទូជាងអាខាងក្រោម Denture ណា
And we can see that this acrylic in the upper denture is older than the lower denture. The acrylic's newer.
ហើយយើងមើលម្យ៉ាងទៀតយើងឃើញថាថ្មិញខាងលើហ្នឹងអាគ្រីលិកសម្រាប់ធ្វើថ្មិញខាងលើហ្នឹងវាចាស់ជាងអាគ្រីលិកសម្រាប់ធ្វើថ្មិញខាងក្រោម
cái này phải yêu
បាទ
đập buồn khả năng mỗi tuần buồn khả năng
The other questions that I would need to ask are about the patient's medical history. Do you take any medicines?
បាទយើងមានលេខថ្នាំរបស់
ăn nhân lên ăn anh ạ
បាទអញ្ចឹងសំណួរបន្ទាប់យើងសួរតាក់ទងជាមួយនឹងសុខភាពទូទៅគាត់អ្នកជំងឺគាត់ប្រាប់យើងថាអត់មានបានលេបថ្នាំអីរាល់ថ្ងៃហ្នឹង
So she's very fit and well and takes no
Nam
medicines.
cầm láng đây tại
លេប
chỗ
ថ្នាំកំអត់ជាកាស្យូម for strength for physical strength
Sure. Okay. But no Western medicines. That's good. Okay. And we found out a little bit about her dental history in terms of when she lost her teeth, and these are the only dentures that she's worn. And when I look at my patient here, I know that she's come in with her daughter and grandchild, and which means how many children, how many babies did you have?
con
8.
អំបីមកយើង
And how many grandchildren?
bọt bay chạy
ចុះចាំមកនិយាយចាំ
cháu chiên hình thầy
20.
cháu tuột bởi
great grand
Oh,
great grand three
great grand
oh
three.
no great grandchildren
cháu tuột bởi
Eight.
cháu và cá chiên hình thầy
great children 20 great grandchildren 8
And how many children did she have?
8
8. Oh, so 8's a big number, lucky number. Okay. All right. And I can also see, in terms of a general physical appraisal, my patient's very mobile, very able, and we're talking very well. And I don't imagine that we're going to have too many problems in terms of developing a very good professional relationship over this week.
អញ្ចឹងគាត់ថាអ្នកមកយាយគាត់សុខភាពគាត់ល្អហើយពេលនិយាយពាក្យអីក៏ល្អដែរអញ្ចឹងការទំនាក់ទំនងគ្នានឹងធ្វើបានល្អគាត់ប្រហែលគិតថាអត់មានបញ្ហាអីក្នុងផ្លូវតាំងពីដើមដល់ចប់ហ្នឹង
dạ
So now what I need to do is move on to the examination. And I start with all my patients by doing an extra oral exam. And what I say is I'm going to have a little feel around your head and then I'll have a look inside your mouth, okay?
ចឹងមកយាយគាត់ប្រហែលជាត្រូវធ្វើការពិនិត្យស្ទាបតិចតួចទៅហើយចាំគាត់ពិនិត្យ
năng
អញ្ចឹងយើងឥឡូវយើងធ្វើ extra oral examination ហើយបើយើងធ្វើ intra oral examination តោះ
Is it okay if I touch your head? You want to
ấy
feel-
vậy anh thầy nên lại đặt sau một việc mình năm đó đi năm đó
So just pop your head back.
បើយើងជួយបង្ហាញក្បាលទៅក្នុងបាក់
And what I do is I
anh
just
chơi cái đám đó bọ à
I start by just pushing and feeling temporalis.
អូខេអញ្ចឹងទី1គឺយើងស្ទាប
And buccinator and masseter,
យើងមើលសាច់ដុំ vaccinator ហើយនិងសាច់ដុំ masseter
mentalis,
យើងមើលសាច់ដុំ mentalis
anterior belly of digastric,
យើងមើលសាច់ដុំ
posterior
ផ្នែក
belly,
យើងមើលសាច់ដុំផ្នែកខាងមុខរបស់ digastric ហើយនិងផ្នែកខាងក្រៅរបស់ digastric
and I'm just feeling down sternocleidomastoid,
ហើយគាត់មើលសាច់ដុំ SCM
and trapezius.
ហើយបន្ទាប់មកយើងមើលសាច់ដុំ trapezius
Okay. No pain?
មានការឈឺចាប់ដល់មួយអត់ឈឺ
anh men thì ấy
No
rồi
pain.
Good. Then going to examine the Tmj joint. Just open,
ហាមកវិញ
close,
បិទវិញបិទ
open,
ហាមកវិញ
close,
បិទមកវិញ
and I can feel a little click on the left joint.
កាប់ស្លាប់
No pain.
មានឈឺចាប់និយាយកន្លែងស្លាប់
anh men lại
អញ្ចឹងគាត់ស្ទាបមើល TMJ ហើយទៅគាត់មានអារម្មណ៍ថាដូចជាលឺ click បន្តិចនៅកន្លែង TMJ
So it's okay to have a click in your joint
cả hai giờ
as long as there's no pain.
អញ្ចឹងអត់អីទេអា click ហ្នឹងជាអត់មែនជាបញ្ហាទេហើយសំខាន់អត់ឲ្យឈឺទៅបានហើយ
I not hurt you?
គាត់អត់ធ្វើឲ្យមកនិយាយឈឺណា
អត់អីទេ
no no
I'm good dentist.
គាត់តែថ្មីល្អហើយណា
Okay. So I'm now going to have a little look in the patient's mouth. All right. But just before I do that, I'm just having a look at her profile, and we can see she's lost a little bit of lip support here. It's inverted. I can feel her premaxilla there, so she's still got quite a prominent maxillary ridge. But you can see she's a bit sunken in. I'm looking and thinking she's got a very flat chin. And I'm thinking skeletally that this patient is a class 2, division 2, which means she may not have very much space in this mouth to make dentures. And I think I can see that in her existing dentures. And that the freeway space may need to be around 4 to 6 millimeters. Just something to remember. And I get that just from looking extraorally.
នៅពេលដែលគាត់មើលទៅលើអ្នកជំងឺអញ្ចឹងទៅគាត់ឃើញថាអ្នកជំងឺ facial profile ឬក៏ skeletal profile ហ្នឹង class 2 division 2អញ្ចឹងមានន័យថាប្រហែលជាអត់មាន space ច្រើនទេសម្រាប់ធ្វើបើសិនជាយើងគិតលើ freeway space ទៅប្រហែលជាមានតែ4ទៅ6 mm ទេ
So now I'm going to have a little look inside.
បាទយើងជួយហាមកតិច
And just see how I use the mirror to retract the cheek.
yes
And I'm using my index finger to palpate the ridge.
យើងឃើញថាលោកគ្រូគាត់យកកញ្ចក់ដើម្បីទៅធ្វើមាត់ឲ្យធំហើយគាត់យកដៃច្អល់គាត់ទៅ palpate
And just, sorry, can I come and have a look up the top?
yes sorry
And up the top, I'm looking, and again, using my finger to just palpate the ridge.
Yes.
And I'm feeling for anything sharp, anything that might make wearing a denture uncomfortable. And my patient's okay with all of that.
you mean sharp bone
Yes. Yeah.
គាត់ថានៅពេលដែលគាត់ស្ទាបចឹងទៅគាត់ឃើញថាមាននៅសល់ឆ្អឹងដែលសួយបន្តិចអាហ្នឹងប្រហែលជាបញ្ហាដែលធ្វើឲ្យពាក់ denture ទៅមានការឈឺចាប់មកយាយជួយធ្វើសំឡេង
Good. Poke your tongue out.
មកយាយជួយលៀនដាក់ចេញក្រៅ
And so we've got a nice healthy tongue. Yeah, good. So I've had a look
ខ្ញុំក្តាស់ហើយ
a look in the patient's mouth. She's got nice healthy ridges. She's got a nice healthy tongue. Her mouth's wet. There's saliva in there, so that's really good.
តិចហ្នឹងជាគេថាជើងមិនយើងបាក់ហ្នឹងវានៅជាប់ទៅហ្នឹងតែគឺអត់ប៉ះពាល់អត់ចេះចេញកាលណាគេយើងទៅគឺវាកាន់ចឹងពេលដល់ពេលដល់
she said that the sharp bone underneath it the doctor said is the root of the teeth but they don't remember to just that now it cause no problem
Yes. So our patient has told us that she may have a retained root underneath her gum, but it's not a problem, and we're just going to leave it there.
អ្នកជំងឺប្រាប់ថានៅជើងថ្មិញគាត់ហ្នឹងប្រហែលជាមានសល់ឬដែលគេអត់យកចេញបើសិនជាវាអត់មានបញ្ហាទេគឺយើងទុកវាចោលហ្នឹងដែរ
អត់ប៉ះពាល់
បាទអត់អីទេ
ពេលដែរមកដាក់
បាទ
ពេលពេលកាត់ណាមក
បាទ
គេថានឹងអត់ប៉ះពាល់អីអត់អីណាប៉ះពាល់ទៅសម្រាប់ឲ្យជីកន្លែងហ្នឹងtrongវែកកន្លែងហ្នឹងយកចេញអានេះដល់យើងទៅថាវាទៅមកចឹងណាអាហ្នឹងដកជើងវិញខ្លះវាប្រហោងកណ្ដាលចឹងទៅដល់នៅជើងខាងដកនេះវាចេញមកកណ្ដាលអូកណ្ដាលអានេះបាទរឹសកែវវិញ
បា
បាទ
ទលើចុងតិច
ហ្នឹងហើយ
So I'm ready now to make this patient take some impressions. And in terms of a treatment plan, I'm wanting to make her some new impressions, acknowledging that she's got a class 2, division 2 jaw relationship, and she might need a slightly bigger freeway space than if we were making dentures for somebody with a class 1 skeletal relationship.
អូខេអញ្ចឹងយើងត្រូវការធ្វើការខំពុំហើយយើងឃើញថាគាត់ class 2 division 2អញ្ចឹងទៅប្រហែលជាត្រូវការ space ធំជាងអ្នកដែលមាន class 1
And so my treatment plan is that I've got a lovely patient who needs new dentures. Her old dentures are worn out, and we could just check the bite of the dentures.
Mà đặt mình đang to nghe nào đang đặt mình nhằm câu cặp ấy ban này cặp độc nhằm ban
បាទ
xóm nhằm đưa ra mình bỏ bạc ban
ឥឡូវយើងឆែក occlusion តិច
បើកាន់ដែរទៅ
So, just can you see how the patient's denture is dropping? That dropping really tells me that we don't have adequate support. Support first. And when I look at that denture, I've said that denture base is not extended back far enough. And I wonder if the patient trimmed this back because she gagged.
Do you want to ask?
Ask.
ម៉ាក់យាយពេលពាក់ហ្នឹងទៅម៉ាក់យាយដែរចង់ចោលហ្នឹង
à nắng kia thật ở bên trong nó không tới là ta vào thôi tập vậy
ដោយសារតែម៉ាក់យាយធ្លាប់ពាក់ទៅចង់ចោលចេញមកខាងចង់អួត
nó cái đặt vậy những chân chảo là ní cái đặt vậy những anh chảo
she has
anh ấy đặt chiên Việt Nam cái doctor
បាទ she had gap
Yep.
vô
So-
đặt nó ở đây
So we've discovered that the upper denture base was shortened because she was gagging on it. It was too big.
yes
And there's a constraint on us making new dentures. How far we can have the peripheral border of the denture.
អញ្ចឹងយើងឃើញថាពេលមិញពេលយើងដាក់ denture ទៅអាហ្នឹងវាឈូសហើយយើងឃើញថាខ្វះ support ដែរអញ្ចឹងដល់ពេលយើងមើល border denture ខាងក្រោយទៅគាត់ឃើញថាអាខាងនោះទៅគេ trim ចោលហើយផលដែលគេ trim ហ្នឹងដល់ពេលយើងសួរអ្នកជឿថានៅគេគាត់ពាក់ទៅចេះតែចង់ក្អួតអញ្ចឹងបានគេ trim អញ្ចឹង
Now, can you just bite? Can you see on this side
yes
that the teeth are not touching?
អូខេយើងមើលឃើញខាងស្ដាំនោះថ្មិញអត់ប៉ះទេ
You might need to come around the other side. Oops. Can you see? Bite.
ខាងមក
nó đóng mịch bịch thật
God, if you can put the mirror downside and yes.
You're in the
Yes,
in the
yes.
light. Can you see there? Can you see the dentures are not touching? And that is part of the reason why the patient can't chew very well. Okay? All
យើង
right.
មើលឃើញខាងស្ដាំថ្មីអាផ្នែកខាងឆ្វេងរបស់ denture ហ្នឹងអត់ប៉ះគ្នាអញ្ចឹងជាហេតុផលដែលអ្នកជំងឺតាពីអត់សូវបានល្អ
And when it comes to checking the stability of the lower denture, I put my fingers on and wiggle.
បើសិនជាយើងចង់មើលពី stability របស់ធ្មេញខាងក្រោមយើងដាក់ដៃសងខាងហើយយើងលប៉ាក់លប៉ើកមើល
And the same with the upper.
ហើយខាងលើក៏យើងធ្វើដូចគ្នាដែរយើងដាក់ដៃសងខាងយើងលប៉ាក់លប៉ើកមើល
All right. My impression trays in,
ឥឡូវយើងចាប់ផ្ដើមខាំពុំ
and I always use a dental mirror.
ហើយគាត់តែងតែប្រើអាកញ្ចក់ហ្នឹងដើម្បីហែកមាត់
And I turn the tray in, up at the back, and then up at the front.
យើងសកាត់ខាងក្រោយមុនបន្ទាប់មកបើយើងសកាត់ខាងមុខ we compress the back side first and then
Just put it in up at the tuberosity first,
yes.
and then lift it up at the front.
mình hơi tội sao mà nó chỉ đặt thôi thằng đi đau thằng đi bắt đầu
អូ
chỉ đặt thôi á mình chắc nó
បាទគឺ
đã
ដាក់
đặt cục
អត់គ្រប់ចំនួនថ្មីវា
của mình tiêm cầm to thì đặt kia đặt
បាទបាទ
đặt cam đó
បាទបាទអញ្ចឹងនៅពេលដែលយើងខំពុំគឺយើងសកាត់ខាង tuberosity មុនបាទយើងសពតថ្មីខាងមុខខាងក្រោយតាមក្រោយ The patient said her old denture doesn't put the wisdom.
My patient has a lot of dental knowledge. Was she a dentist?
I don't. She is
Do you know dentistry?
Mẹ giấy có ngồi thầm mẹ giấy đang người thông minhច្រើនmẹ giấyធ្លាប់យល់ច្រើនពីមុនមក so she understand dentistry well
Well, how come?
ចាំមẹ giấyហ៊ានមកពីណាគេណាមẹ giấy
ចូលដាក់វិញហ្នឹងជាងគេបញ្យល់លឿន
she said when she go to the dentist explains to her
Oh, you have a good dentist.
បែបហ្នឹង
បាទអញ្ចឹងមẹ giấyថាមកបែបល្អហើយបែបមិនបាច់
So what I've done to my
ឥ
tray
ឡូវនេះដាក់ដុកទ័រយួន
is I've just
តែខ្មែរយើង
I've just put some wax around it to make it a little bit more comfortable. And the other thing I'm going to do
កូនអត់ឲ្យដកផ្ដេសផ្ដាស់
is I'm just putting 3 little stops in there as well.
មានចាំទៅដុកទ័រដុកទ័រកាត់
Good. So we've got 3 stops there as well. So I'm ready almost to take my upper impression. So if we could have a scoop. Okay, no, it's fine. Okay. Wait. Good sitting. Yeah. Very warm.
ហាមមកយីហាមមក
You're going to have to be faster. So I'm sure.
Đấy, đang nữa.
Chết bàn tay
Well,
I will try to have a volunteer student help you with
it's too runny. So, what we're discovering here is that we don't have the scoop measure for the alginate or the water measure, and you really need those to get the right mix of alginate.
បញ្ហាដែលយើងមានឥឡូវគឺថាយើងអត់មានលភាថាអត់មានទឹកសម្រាប់វាស់អញ្ចឹងទៅវាពិបាកកាលពេលយើងខំពុំយើងត្រូវវាស់ហ្នឹងឲ្យបានត្រឹមត្រូវ
We've got a very good patient here. And that is set.
Yes.
And that's our impression. Now, some more water.
អញ្ចឹងឥឡូវយើងឈប់ប្រើ alginate យើងប្រើប្រភេទ impression មកទៀតយើងថា compound
Just a little bit longer.
Yes, this is impression material.
Yes. So, and it's an impression material which is a hard wax,
Yes.
and I'm softening it.
ប្រភេទ impression material មួយទៀតនេះគឺជាប្រភេទដូចកមួនអញ្ចឹងនៅពេលដែលយើងនេះមុននឹងយើងខាំយើងត្រូវដាក់ទឹកក្តៅដើម្បីលាយ
So this is how it comes. It's a hard wax, and at the moment I've got it in some warm water, and I'm softening it.
ដំបូងមកអញ្ចឹងទៅដុំកម្រួនមួយស្ក្រឹងដល់ពេលអីគាត់ដាក់ទៅតែក្តៅដើម្បីឲ្យវាទន់អាហ្នឹង compound
So I've just got it, loaded it into the tray now, and I'm just got it in the warm water.
អានេះគេដាក់ឲ្យវាទន់ដើម្បីទន់ដើម្បីឲ្យកម្រួននេះទន់
nhưng mà như đây anh làm bánh cò bớt đôi anh làm bánh cò
It's a little bit warm. And the same way into the mouth, up at the back. Okay. All right. So I've taken it out. And we can see we've caught the tuberosity, both sides, and we've caught the ridge quite nicely.
អញ្ចឹងយើងឃើញថានេះយើងបាន tuberosity បាន rig អីបានមួយ set មក
Now, I'm just going to do an alginate wash over that. Mixed up a slightly runnier mix of alginate.
Hello
Pop this back in.
Can you explain to them about it?
So what I've done is I've put an alginate wash over the compound just to pick up more detail and to get a more accurate impression.
អូខេអញ្ចឹងគាត់ក្របអា arginate ពីលើហ្នឹងដើម្បីយក detail ឲ្យបានច្បាស់ជាងហ្នឹង
Okay. Good. And that's just given me a nicer impression all the way around. I've caught more of the sulcus, back on the hamulus, and we're capturing some of the palate. So we can pour up a nice model on this, okay?
យើងឃើញបានថាបានទាំងអស់បាន sulcus បានដល់ក្រោយ tuberosity ហ្នឹងទៀត
In particular, we've really caught the peripheral roll of the sulcus. And we can start to see now that when we compare my impression with the old denture, you can see that we're going to actually be able to get more support because our denture base is going to be bigger. It's going to fit better, okay? So we've done well. We need to do the lower one now.
បើសិនយើងយកអាខាំពុំប្រៀបធៀបជាមួយនឹងអា denture ចាស់ហ្នឹងយើងឃើញថាពុំក្នុងយើងប្រកាសជាជាប់បានល្អជាដោយសារ base វា support បានច្រើនជាងឥឡូវយើងធ្វើខាងក្រោមម្ដង
So we have a lower tray and again just turning it into the patient's mouth and just sitting it over the ridge. And look, our patient knows what to do with her tongue. She's lifting her tongue up when I put the tray in, and I'm going to ask her when I take the impression to move her tongue from side to side, like that. Look at me, like this.
នៅពេលដែលយើងខំពុំខាងក្រោមនោះយើងប្រហែលជាសំណងប៉ឲ្យអ្នកជំងឺយើងលើកដើរទៅឆ្វេងទៅស្ដាំធំពេកមែនមិនទេ Sir, she said the impression the impression tray a little bit
The lower one?
yes
It's all right, it needs to be.
ធំ
So again, I'm going to use compound to take my lower impression because it's got good resilience.
ឥឡូវខាងក្រោមគាត់ដាក់ compound ទៀតដោយសារតែ compound ខំបានល្អជាង
តែដាក់ណាំវាចូលចាំពួត
In the water, just to soften it. Just, sorry. It's going to be a little bit warm.
ចឹងមកនេះដៅតិចសិតត្រាក់តែអត់អត់លី
អត់អីតែក្តៅនិយាយដល់ក្តៅអត់ហៅនៅជាក្តៅនិយាយ
Okay, so I've softened it. It's a little bit warm, so I've warned my patient.
បើក្តៅប្រាប់បើក្តៅខ្លាំងប្រាប់ ក្តៅណាស់វិញលឿងតែទៅឆ្វេងទៅស្ដាំអី
Tongue side to side.
ទៅខាងស្ដាំម្ដងទៀតមកយី
And do you see
ទៅខាងឆ្វេងមកយី
how I'm holding the tray in the mouth? Holding the tray down on top of the ridge between my index finger and my thumb is holding on to the inferior border of the mandible.
នៅពេលដែលយើងកាន់ត្រេហ្នឹងឃើញក្មេងអាកាសច្រឡំថាអាដៃច្អល់ហ្នឹងយើងសកត់ reach របស់ viola ហើយដល់ពេលមេដៃយើងសកត់ទៅកែមខាងក្រោមនៃ mandible.
And look, we've got a nice impression there. We've recorded the retromolar pad, the external oblique ridge, the labial sulcus, external oblique ridge, retromolar pad, the lingual sulcus, all the way around.
អញ្ចឹងឥឡូវយើងមើលឃើញថាសំបីត retromolar pad ក៏យើង record បាន external oblique ridge ក៏យើងរកឃើញ labial sulcus ជាមួយនឹង lingual sulcus គឺយើង record បានទាំងអស់
ចាំnó rơi rơi rượu trên chị bắt nó hơi xanh đâu vậy cái đàn đây nấu
អត់បាទ
đôi cái đàn tua thơm xanh rượu đôi trên bắt
បាទ
mưa nó đôi bây giờ nó xanh riêng
បាទមកដូចទៅ
một đôi
អត់ឈ្មោះកែវឈ្មោះ
ở đây một nòng lưới nó một nòng lưới nó xanh rồi chào lên cho một mặt đọc cái chén
ជួយចិត្តខក
Like scrambled eggs.
maybe it's spy or something
các con chết con thử
បាទគាត់ចិញ្ចឹមញូ
And just pop it back in the mouth the same way. And my patient is making movements with her tongue from side to side. And on these impressions, we're going to go and pour models. And from these models, we will make special trays. And tomorrow, we'll take even better impressions with better quality impression materials. And what we're trying to do is record all of the remaining bone that will give us good support. Yeah, no, look, I just don't like the way that impression material's setting. Looks like we have neurofibromatosis. Yeah, I'm actually quite happy with just the compound.
ហេតុផលដែលគាត់ដកអាហ្នឹងចេញដោយសារតែយើងមើលទៅដូចចាយគាត់ខិនចឹងហើយជាអ្នកហ្នឹងប្រហែលជាហួត delay អីអញ្ចឹងគាត់